Voicing for the facts about bipolar disorder. I've noticed more and more cases on the newspaper, on TV, of bipolar disorder. Most recently, this disorder was linked with Britney Spears. People thought maybe she had bipolar disorder. Really, I'm not really here to discuss that or label anybody. I just really want to, straighten out some ideas of some wrong ideas that people have and make things clear. Bipolar disorder is linked with mood swings. We all experience mood fluctuations in life. We have different frustrations, different happinesses, and times of sadness. But with bipolar, it's more severe. It's different. It's not the same experience. You can't control it or try to be more powerful than the disorder. It's a chemical imbalance. It's not the person's fault. It's a really serious medical condition. The old term for bipolar disorder was manic depressive. There's two parts of this disorder. There's the mania and there's the depression. The mania is the high part, the positive feelings of this disorder. The person can have really big ideas, they have a lot of energy, they're really productive, they get a lot of things done, they sleep less, they think positively, they think that they have big, powerful, great ideas. Their judgment can be faulty. They're more impulsive, they're more apt to act on quick decisions. It's hard for them to focus during this manic period. Some people gamble, have sexual relationships, or go shopping during this time. So the mania is the high part of the mood swing, and the depression is the downward spiral. It really looks the same as normal depression. Same symptoms. You feel lousy. It's hard to sleep, or you sleep too much. You have no appetite, or you indulge yourself in food. These people really feel like they have no hope for the future. They don't enjoy everyday things. They can't focus. Some of them even contemplate dying. Depression with bipolar experience those same symptoms, but it's worse than just depression. It's because the people that are bipolar have experienced that high and have experienced that power and that energy, and now they feel worse that they're on a downhill spiral. The suicide rate is higher for people with bipolar than it is for regular depression. 1 in 5 patients who do not take their medication will kill themselves. The fluctuation in the mood of bipolar happens over different times for all different people. It doesn't look the same for everybody. For adults, maybe the mania stage could last a couple weeks or even months. Then it could plateau and you could be fine. That could also last several months or weeks. Later, the depressive state starts, lasting months. In younger children, even teenagers, it tends to be more fluctuated. Sometimes it could be just every day. There's different highs and different lows. It could be that way with adults too, but it's more common in younger children. It's hard to recognize the symptoms of bipolar disorder. reasons why that is because a lot of people use alcohol or drugs to cover up the pain. We call that self-medication. They're trying to make themselves feel better, but really they're making the situation worse, and it could cause more problems. Bipolar disorder causes the chemical imbalance in the brain. Medicine can help that, but it cannot cure it. The medicine can help control it. People with bipolar disorder are not doomed for life. They can have a great and wonderful life if they learn how to control their disorder. It's important for them to take their medicine, work with their psychologist and the doctor. There's different services offered for them. They need to work with those people to help them find the perfect medicine. It's also important to eat properly and sleep. Have the same routine in your sleeping and exercising. The combination of eating well, sleeping well, and exercising can really help. Also, family support needs to be there. The support of friends and family can really make a big impact. People with bipolar disorder aren't often to ask for help, so those family members and friends need to recognize when they go through the mood fluctuations and need to help and encourage those people. Maybe a bipolar patient can go to a counselor to talk about it every week. Stress is another trigger for bipolar disorder. Some people can be very stressed in their marriage or their relationship, and if you lower that stress, you can control the disorder better. There's different things like that you can do. The final thing about bipolar disorder is that a lot of people see them as very violent or out of control, but that's the portrayal of the movies. They want to exaggerate the disorder to make an interesting story, but in general, people with bipolar disorder are not violent. There's a lot of famous people that have reached out and shared that they have this disorder, such as President Roosevelt, the actor Robin Williams, David Blaine, the astronaut Buzz Aldrin. There's a list of a lot of people that have bipolar disorder, and they can go on enjoying life.